Hello, my name is Georgiana Crișan and I'm a third year student at Cluj School of Public Health. So today I will present a systematic review based on types of differential effects of vaccines from different aspects: geographical location, sex differences in immunologic responses, and vitamin A supplementation. Background: a vaccine is a medical product that is designed to protect from many diseases. It is well known that any type of vaccine can cause side effects, as well as any type of medication. Each year, millions of infants and adults are receiving vaccinations. Most of them, the side effects of vaccines are mild, but in some cases, they are having some serious side effects such as fever, rash, and others. It can also cause death. Types of vaccines responses are very different from one to another, from geographic location, from sex differences, to vitamin A supplementation. Our objectives is to explore the literature for the effects of vaccines from epidemiological, clinical, and immunologic studies in order to reduce mortality and morbidity. This will further support to the knowledge of the entire population and will be a good influence in reducing mortality and morbidity. Methodology. A search strategy was developed in order to identify papers that are addressing the problems of vaccines effects in order to reduce mortality and morbidity. In order to identify relevant papers to the topic of effects on vaccines, I have conducted a systematic search on two databases, PubMed and Oxford journals. Due to Google Scholar, we found books, technical reports, and conference proceedings. As a result, an initial search retrieved 1,778, from which we have selected 67 to be relevant to the topic after a screening of titles and abstracts. The methods that were used were both quantitative and qualitative, and also randomized trials. The subjects that were included in the studies were both healthcare service receivers and also providers. So the effects of geographic location on vaccine responses. Some of them are saying that the responses of vaccine can or are very different from urban to rural, from high versus low socio-economic areas, or from developing, like Malawi, to developed United Kingdom world. So the sex differences in immunologic responses to vaccines. Many studies are showing that are clear sex differences between childhood and adult vaccines. In general, females are having higher rates of adverse reactions. Many immune-regulated genes are expressed on X chromosome, which in this particular case it might escape the X inactivation, where it allows greater gene expression among females. The vitamin A supplementation. Due to the vitamin A supplementation, studies are revealing different cases, such as in a randomized trial when combining vitamin A with vaccines, the effects had not been properly evaluated. But another type of case is in Asia, where are showing that neonatal vitamin supplementation are causing a decreased mortality. whereas in Africa, studies are suggesting no benefit or on an increased mortality. One of the limitations is the fact that the immune system reacts differently when other factors are interfering, but as an implication for the future, we hope that with this study we will help other studies to better focus on vaccine, and also we will provide them all the sources that we gathered and some conclusions that we have come up to. These kinds of observations are having a major implication for basic vaccines research and could also could be a guide for a vaccine policy. Thank you. That was all.